Circle back to what is World Cancer Day, and it's a big drive from South Africa's government as well as many other NGOs in trying to draw attention once again to cancer in our country, especially lung cancer, which is still a massive contributor. The Health Ministry leading an awareness campaign. Let's go back to Silindelo Masikane, who I understand in a moment will have the Health Minister with her. Hello to you, Slee, and let's come to you to have a chat to the Minister.
Yes, Gareth, of course, the Minister is on a bit of a walkabout, so I'm going to ask Tammy to just try and get in front of the delegation right now. To remind our viewers, we are at the FWC Hospice, just close to Westbury, in Johannesburg, where we have the Pink Drive that is basically offering free screenings, free cancer screenings for this particular community. The kinds of services that are being offered are screenings for prostate cancer, as well as breast cancer exams, and of course mammograms, as well as pap smears. And of course we do have other services such as HIV testing as well, and free condoms that are being on offer. I'm going to try and speak to the Minister while he's on his walkabout as he is engaging with some of the stalls. Minister, perhaps maybe take us through how you as a department feel about these kinds of initiatives.
Well, this is very important, and thanks to Pink Drive, who have been in this for quite some time. As we know that cancer is really a very serious problem in our society. As societies develop, people, change in terms of our diet, our habits, and we see that, all sorts of cancers, breast cancers, cancer of the cervix amongst women, colon cancer getting quite a serious, threat in our society. Amongst men, the prostate, lung cancer. So this is a very important day in terms of awareness, making people aware of, the threat of cancer. We know that over the last few years we've all been worried about COVID-19. The COVID-19 is currently in a very manageable state. It's not yet over, but very manageable. And now we need to refocus again on the non-communicable disease, and one of the major ones is the whole problem of cancers. So we're very grateful for the partnership with Pink Drive, the screening of people who have any concern about possibility of cancer, so that they can be referred for treatment.
And we know, of course, there are issues around infrastructure and lack of capacity in many of our hospitals. Perhaps what are the initiatives moving forward to try and address this?
Well, we on an ongoing basis are improving our capacity, including in terms of this problem of cancer. We're discussing with our colleagues, the MECs, making sure that, for instance, provinces which still don't have the facilities for treatment of cancer. Currently, your smaller provinces, Limpopo, Mpumalanga, Northwest, those are the provinces, the Northern Cape. So we're building capacity. We do have in the National Department a specific grant which we provide to various provinces to continuously build the capacity for cancer screening, early detection, and also especially treatment, because it's useless if we're going to screen and they do the screening, they do the finding that somebody has early cancer. Because the key thing is to find it early, and then we must have the facilities to make sure that such patients can be treated. So we're increasing the capacity for that. We wish we could have more resources, so that we could build up all those radiation therapy, chemotherapy in all the provinces. At least we would be happy if every district in the country could have a capacity to treat cancer. But we get in there bit by bit.
Thank you so much, Minister. I'll let you continue with your walkabout. That is Minister Joe Phaahla, the Health Minister, talking to us about some of the initiatives the department itself is trying to put in place to also support initiatives like the Pink Drive.